I think that there's really good patients who are really good patients for a gummy bear implant, and there's patients who probably wouldn't like a gummy bear implant because that gel is a little bit firmer or holds its shape a little bit more. It does affect the way that the breast looks afterward as well, because it's going to give a little bit more form and shape to the breast. With a lot of patients really want that, but then there's definitely patients who don't want that. They want a much more natural slope, and that is probably not the best implant to give you that.
Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita Ramanathan, board certified plastic surgeon in New Jersey, and I'm joined by my co-host, Dr. Ashley Amalfi up in Rochester. And we are continuing our series on breast augmentation. We're answering very specific questions, those questions that are hot topics that you just need to know about before your surgery. And today we're going to talk about whether or not you need a gummy bear implant. Now this is such a hype word, right, Ash?
Yes. Oh my God, gummy bear. If I had to count the number of times we hear the word gummy bear in our office, it's crazy, right? I mean, and a gummy bear is a food. It has nothing to do with breast implants, but
right.
It's, what it's really referring to is the cohesivity, or kind of like how thick the gel is of the implant. And so, and that's all it was supposed to mean, right? Like when they talked about gummy bear implants, they were just talking about those more cohesive implants that, like if you cut a gummy bear in half, that the two parts would stay together, it wouldn't ooze out like a liquid. And that is really what we are referring to, because a lot of people, whether they've heard the word or not heard the word, it's kind of a confusing thing, right? Are your patients a little bit confused about it as well?
Yeah, no, I agree with completely. I think people hear about it, they know that they should get it if they're thinking about silicone implants, but they're not really sure what it means. And you're correct. It talks about the cohesivity. So our silicone, we call it a silicone gel, but it's actually not really a gel that oozes out. But the newer generation implants are just very cohesive. So like you said, Ash, I mean, you cut it, it's like cutting a gummy bear. It's just like a gummy bear cut in half, right? It doesn't ooze or anything like that. So that's really all that it means in general, right? And I think just with marketing and all of that stuff, people think of like very specific brands and types when we talk about gummy bear, but that's not necessarily what it is, right?
I mean, all the brands have these more cohesive implants, and it doesn't mean that they're right or wrong, because I think that there's really good patients who are really good patients for a gummy bear implant, and there's patients who probably wouldn't like a gummy bear implant because that gel is a little bit firmer or holds its shape a little bit more. It does affect the way that the breast looks afterward as well, because it's going to give a little bit more form and shape to the breast. With a lot of patients really want that, but then there's definitely patients who don't want that. They want a much more natural slope, and that is probably not the best implant to give you that. And so this is, why we always emphasize you need to have that discussion with your surgeon, because for me, the patient who does great with a gummy bear implant really kind of wants a little bit more of that full look, a little bit of more of that upper pull volume, because that cohesive implant, the gummy bear implant, it kind of looks the same no matter what position you're in. And when you're laying down, you still have that nice round breast, and when you stand up, you have that round breast. But I don't know. I don't think that's for everyone. Do you feel the same way?
Yeah. No, I agree. I mean, I think there's definitely patients that don't want, like you said, they want their breasts to look exactly the same, just a little bit bigger, right? And so those are not necessarily the patients that we would use gummy bears, because that, your breast does take on a little bit more of the shape of the implant, like you were saying, right?
Yes.
So it's a little bit rounder, it's more firm, which is great, but it's not for everybody.
Yeah.
And so that's really where it's important to see your board certified plastic surgeon, because you could talk to them and be really specific about what your goals are and sort of what look you're going for. And then we can sort of guide you to which implant may, give you that result versus others, because you won't find it with every implant.
Yeah, it's totally, it'll give you a specific look, and that's why you want to talk about your goals, because that's how you're going to get there. And so it may or may not be the right fit for you depending on what you're looking for. I think the other thing that is important for you guys to know is why these gummy bear implants came to be, and what would the benefit of it be. And really, as a plastic surgeon, I think the benefit of them is really if they rupture. So the more cohesive the gel, the thicker it is and the more it sticks together. And what that means for you guys is that if you have an implant rupture, that the gel is just a little bit easier to clean out, because if the gel is more liquidy, it's just a little oozier and it's messy. It's not unsafe, it's not going to make you unwell, it's not dangerous, it's just messier. And so if the gel is stuck together a little bit more, the thought is it's a little bit easier to clean out if you have a rupture and to do an implant replacement. And I do think that we find that when we operate on these patients who do have a rupture. Have you seen that too?
I have too, but I mean, I think I feel like we should stress too that in the majority of cases, right, unless it's a really old implant, like 15, 20-year-old implant, you're going to have these silent ruptures, right? So even though you have a rupture, it doesn't mean that it's going to be leaking all over your breast and inside of the breast, like tissue or the pocket that we create. Most often, it just stays right within the confines of the implant itself, right? So you're not going to see gel really anywhere else. But we often see breast implant ruptures in those older implants, and that's really when we start seeing sort of that oozing, like that oozy just silicone kind of everywhere, which is difficult to clean out. But that's not the newer generations for the most part, right?
Yeah, and gels have just kind of over time gotten more cohesive, gotten thicker, and that just makes everything just simpler when we're dealing with these ruptures. And again, not something to be worried about, and certainly nothing that you guys are thinking about, but that's sort of the science behind those changes in implants and why they're evolving the way that they are. And it certainly just makes things better, easier, quicker. And but a gummy bear implant gives a certain look, and if you think you're a good candidate for it, then these are the things that you want to talk to your doctor about, but you want to sit and look at them, feel them, and understand the differences between some of the more standard gels and the more cohesive gels. And you're going to look and feel and understand when you sit down with your doc. And I think that's part of making that really well-informed decision.
Right. Right. And I think that's why it's so important to see a board certified plastic surgeon, because unfortunately there are a lot of other surgeons that are performing breast augmentations. And so you really want to see the expert, right? You want to know all of the options. You want them to have a thorough knowledge of all of the implant choices that are available to you and what they look like once they're actually, in your breast. And so what better way to make the right decision with implants than to see a specialist, right? And that's what we are. And so just make sure you find yourself a board certified plastic surgeon. This is our bread and butter. This is what we do. This is what we love to do. But we want you to be happy with your results. And unfortunately, we see so many people who are not, because they just weren't given options and didn't feel like they were involved in the decision making. And that's why we're doing this series, so you guys can know more. You can come to your appointments educated and pick the best implant and have the absolute best result from breast augmentation. Yeah, exactly. I think that pretty much covers gummy bear implants. I hope it answered some questions for you guys. But it is a great implant. It's perfect if you are looking for that sort of appearance and look. And so make sure you see your board certified plastic surgeon, learn more about gummy bear implants, and stay tuned. Make sure you subscribe to Lipstick and Lipo. We have so many more questions on this hot topic of breast augmentation coming up in the next few weeks. So stay tuned.
Awesome. See you guys soon.